Welcome to THAMSAR Telehealth Services Private Limited, Hyderabad. The purpose of this presentation is to bring to your notice an amazing investment opportunity with our company, THAMSAR Telehealth Services Private Limited, which has the potential to multiply your investments many times in a very short span of time. This is the story about Vimala Devi, a mother of three, lost her life abruptly at the age of 29 years after a brief spell of illness. She ignored the symptoms of illness and consulted the local RP doctor for treatment. She was reluctant to go to the hospital because she cannot afford the expenses pertaining to travel, lodging, and boarding in the town. Proper medical treatment could have prevented her untimely death and the trauma that the family had undergone. It is not the story of just Vimla Devi, but the plight of millions of people living in rural India. Over 2.4 million people in India die annually due to lack of proper medical care with ailments which are curable with proper care. This is the worst situation from among 132 nations in the world. So, even after 75 years of independence, India is failing to provide adequate medical care facilities to over 65% of its population living in rural areas. 80% of the rural people cannot access the service of specialists, as 70% of specialists live in urban areas. So for villagers, they have a choice between urban-based healthcare centers and local RMP doctors. So trip to local urban-based healthcare center is little and relatively expensive because it involves travel time and cost, lodging and boarding expenses, patients' attendance expenses, lost work hours cost, and there are other problems like lack of transport, absence of doctors in government facilities. So under these circumstances, Indian villages, they tend to depend on local RMP doctors because they are easily available, accessible, and affordable. But the problem is that they are not authorized to practice medicine. They are not authorized to treat the patient because they lack formal medical education or any kind of training. They exploit the innocence and ignorance of the local villagers, and that is how they make money. So we are trying to solve this problem. So we want to make medical services easily available, affordable, and accessible to the people living in villages. Means we want to connect them to a very reliable source of treatment. So we have a huge business opportunity here. Telemedical centers can be established in villages at a very low cost to serve as the first point of medical care to the village community, providing multi-specialty consultations using the latest trends in technology. So we have internet technology, we have mobile technology, and we have other digital technologies which enable telemedical consultations. Telemedicine provides an excellent solution to treat patients remotely without compromising on quality of care. Over 70 to 80% of health issues can be treated without any physical contact between the doctor and the patient. Telemedicine is a proven concept in United States and China and is rapidly growing in India. So we have developed a product, a digital product, which is a mobile app and also a responsive web app designed to support various telemedical activities such as online real-time consultation between the patient and the doctor, online access to patient's medical history, capturing and storage of patients' clinical vitals for real-time sharing using connected devices, online pharma services, online store for healthcare products and medical devices. So, as far as the urban population are concerned, there is no issue because they can use the product with the gadget, with the mobile phones that they are holding, and they are educated enough to operate the system. But when it comes to rural people, they lack the ability to operate the system, nor they have the required gadgets to use the system. So we have come up with the concept of digital clinic. So which is nothing but a state-of-the-art telemedical center established in a village, which is supposed to serve as the first point of medical care for people living in rural areas. So whenever there is any problem, people can straight away walk into the digital clinic and then they can find a solution, a healthcare solution for their problem by getting connected remotely to the urban-based doctors. So they don't have to depend on the local R&B doctors, or they don't have to travel to faraway places, incurring more expenditure for their health care. So more and more people are likely to visit the digital clinic, especially the women and the children who are so far neglected. So we are conceiving a three-tier architecture for our healthcare services. At the bottom level, we have digital clinics in villages having a minimum population of 2,000 people. And at the middle level, we have Mendel headquarters digital clinics, which are better equipped to do the laboratory analysis, to disperse the medicines prescribed to the patients, and they also provide ambulance services. And at the apex, we have a bedded facility which will admit the patient for in-house inpatient treatment. So this is the structure that we have visualized. And as far as the market is concerned, the market that we are trying to address is very huge. Means we are trying to target the rural India, which has got over 6,64,360 villages. So there are many states which have huge villages. Means predominantly they are villages with no medical facilities, no medical care facilities. So we want to establish digital clinics in these villages. So our proliferation strategy is we want to establish a strategic tie-up with local hospitals which are based in towns and cities, and we want to establish digital clinics in villages which are located at a radial distance of 100 kilometers from these hospitals or partner organization, and provide the treatment, in-house treatment whenever it is required. Otherwise, they'll be providing telemedical consultations. So we are targeting the local RMP doctors, paramedics, medical professionals living in villages, or graduates who have done their graduation in nursing or in pharmacy, or diploma holders, to set up the digital clinics and operate the digital clinics as digital medicine providers. So we have multiple sources of income, and the primary source of income would be from the establishment of digital clinics on the franchise model. And we also have a respecting major source of income coming from online consultations and other services. So this is the timeline. We have a modest start in 2021, where we have incorporated our company as privately limited company. We have spent around 30 lakhs for the development of the product, and we have developed almost all the features, and we are going to enhance the product. So coming to 2023, we have started establishing digital clinics in village. And within a span of 3 years, we want to cross 100 crore mark revenue. So we are looking for a fund of 2 crore rupees. So IFCA Venture Capital organization is already ready to provide us some funds. And we are also looking for some other funds from private investors and friends and angel investors. And would be mostly utilizing these funds for marketing and salaries. So we have a very good investment opportunity here. So the minimum investment should be 1 lakh rupees, and the maximum limit would be 20 lakhs for an individual. And we are going to issue convertible notes for the investment that was made. And the gestation period or the maturity period is for 2 years. And the rate of interest is going to be 10% annually on the invested amount. And the payment frequency could be quarterly. You have a choice. You can accumulate the interest, and at the end of the day, you can club it with the your main investment, and then can get these things converted into equity shares. And the company valuation after 2 years would not be exceeding 10 crores. Means we would be issuing shares on the valuation of less than 10 crores, and we would be offering 30% discount for people who are going to invest now. So we are in total compliance with the government, the telemedical guidelines issued by the government of India in 2021. So This is the team I'm having. So myself, I'm the founder of this company. I'm a computer engineering graduate with over 30 years of experience in IT industry. So I have worked in major multinational companies in senior managerial position. I have entrepreneurial experience. So some of the achievements that we have already made is we have won the best project award at the all India level, and we have received the award from the Minister of Social Justice and Empowerment. We have received best healthcare startup award from the Bharat Startup Award from International Brand Equity magazine, and we also got incubated by T-Hub. We are among the top 17 companies which got selected for AIC T-Hub cohort program. We are among top 10% of the companies which got selected from among 6,000 plus companies in India to get selected for Leap to Unicorn program, incubation program. So in case you have any interest in investing in my company, you can contact me directly. Thank you so much. I'll be very happy to take your call. Thank you. Thank you so much.